Bismillahirrahmanirrahim. Assalamualaikum, salam sejahtera and good morning kepada semua peserta webinar kali ini, Autism in a Nutshell. Alhamdulillah, webinar pagi ini merupakan aktiviti virtual kedua yang dianjurkan oleh pihak NRC sepanjang PKP ini. Selepas webinar pertama 2 minggu lepas berjaya mendapat sambutan yang agak memberansangkan. Jadi pihak NRC percaya ramai di luar sana yang menginginkan satu saluran yang mudah dari segi masa dan kaedah capaian untuk menimba ilmu atau isu yang berkaitan dengan autism. Jika ada yang masih bertanya-tanya apa dia NARC ini, so NARC bermaksud National Autism Resource Center yang merupakan sebuah pusat setempat dan pakar rujuk berkenaan perihal data, kepakaran dan penyelidikan berkaitan dengan komuniti autistik. Dan ia bernaung di bawah FSKM UiTM.
Alright, Assalamualaikum, selamat pagi semua. Terima kasih kepada Puan Zarina, moderator untuk kali ini dan juga National Autism Research Center UiTM kerana menjemput saya untuk berkongsi sedikit ilmu mengenai autism. Okey. So, saya just start teruslah. Okay, hari ini kita akan bercakap mengenai autism in a nutshell. Basically, it's just a summary about what autism is all about lah. Okay, autism spectrum disorder is actually one of the neurodevelopmental disorder that occur in children. So, normally the characteristic is impairment in communication, in the behavior and also in the social functioning. So, you can see there's a problem in this area since early childhood. So the prevalence in Malaysia is about 1.6 in every 1,000 children aged from 18 to 36 months of age. So this is quite high, and normally boys have higher prevalence of getting autism compared to girls. I think if I'm not mistaken, the prevalence is about 4 boys to 1 girl. So the thing is, when it comes to diagnosis of autism, a lot of children who have difficulty in speech delay and also behavioral issue frequently placed in special education class without accurate diagnosis, because people confuse since that speech delay is one of the symptoms to diagnose someone with autism. So some may think or assume that the child who unable to speak even at the age of 3 or 4, so they think that this child actually has autism and therefore place them in a special education class. Okay, so early diagnosis is very important to diagnose children with autism, because then you can offer the best treatment and to get the best outcome of the condition. Okay. So what are the symptoms of autism? So basically, as a clinical psychologist and psychiatric and also psychiatrist, we diagnose based on DSM-5. Okay, so if the child have to meet the difficulties in 2 areas or 2 aspects of their life, which is the social communication part, restricted and also restricted repetitive behavior or interest. So as I said before, these symptoms can be identified from early childhood. Okay, what does it mean by difficulties in social communication? Okay, so children with autism characteristic, they rarely use language to communicate with other people. So normally they will use gesture, like they point to the object that they want. Okay, some of the children don't have the language ability at all, so they are not speaking, so they may be just mumbling. Okay, so some of them not responding when spoken to. Okay, and they don't share interest or achievement with their parents. You know, like kids when they play or they watch TV and they saw like advertisement on toys or a vacation place, so they will come to the parents and say, oh, I want to go to this place, I like playing this game and things like that. But you cannot see this in children with autism. Okay, And some of them don't understand the use of gesture, like if you point to something, so they don't know what is it that you're trying to say, or if you wave by and things like that, so they don't understand what is it that you're trying to say. Okay, and they have difficulty to read the facial expression of others, and not only that, they also have a restricted range of facial expression when they communicate. So it's hard to tell whether they are angry or whether they are sad or whether they are happy. And you can also see the characteristic of autism if the child don't really show interest to play with other children. If you send, if you go to the playground and take the child to the playground, normally the child will go and try to play with other kids, like run together and things like that. But for those with autism characteristics, they prefer to play alone. And you rarely see them engage in imaginative play. You know, like children, sometimes they use remote control as a car. They use sofa to build a house, and then they pretend like they're drinking from empty cup and things like that. But this kind of play is lacking or not even present in children that have autism symptoms. All right, so the second area is actually restricted and repetitive behavior or interest. Okay, the child, sometimes they like to line up toy in a particular way over and over again, normally in a straight line. And if someone mess up with the toy or their arrangement, then they will have a meltdown or they will have a tantrum. Okay, and some children, they like to speak in a repetitive way, or we call this echolalia. So they keep on repeating the things that they heard. So the things that they heard, it can be just after they heard that thing, or something that they heard like 2 hours back. Okay? And then having very narrow and intense interest. Okay, some of them like only like cars, and they only like the wheels. And also some of the children, you can see this even when it comes to the food selection. They're very particular about food. Okay, sometimes they only take rice and soup. Some kids, they only take noodles. So it's very restricted and very narrow. Okay, needing things to always happen in the same way. Because rigidity is also one of the sign and symptoms for children with autism. Like when, for example, okay, if you want to go to KLCC from your house, okay, you cannot make a stop anywhere because it's actually a disruption of to the child. It's already a disruption of what it's supposed to be. Okay, so you have to go straight. You cannot stop to fill in your petrol and things like that. Okay, having trouble with changing from one activity to another. Okay, like if they play with something or they engage in certain activity, it's quite difficult to channel them and to take them to do something else. Okay. And also showing sign of sensory sensitivity, like not liking labels on clothes, licking or sniffing objects. Some of the kids, they like to sniff objects before they actually taste it or before they actually eat. Before they actually eat or before they actually play with it. Okay, but not all autistic child presented with all these symptoms. Okay, they can have a combination from the first area just now, the communication part, and few from the behavior characteristics. So a combination of these symptoms, then only you can say that this child is actually having symptoms of autism. And also it depends on the level of severity for each of the symptoms. Then only we can say whether the child is actually have mild autism, moderate autism, or severe autistic. So the severity ranking can also be divided into these 3 levels. Okay, the first one, level 1, is children who need support. So basically, this is referring to mild autism. And then you have level 2 with substantial support. So this is actually moderate autism. And also level 3, this is quite a severe autistic symptoms. A lot of behavior issue also occur because of the communication issue. You know, when you cannot communicate what you want or how you feel, so it can lead to a lot of frustration, which can lead to behavioral issue as well. Okay, so what are the risk factors for a child to have autism? So basically, based on the research, there's no clear factors or etiology to say that if you take this or if you do this, normally people will link it with nutrition, the way you eat. So they say, oh, because you lack of some milk, something gluten or something like that, so it can cause autism. But there's no clear evidence to suggest that it's the cause for autism. Mostly it is multifactorial. It's because of the genetic factor and also the environmental factor. So among the factors that has been identified through research is advancing age. So if a maternal or the mother age more than 40 years old and the father more than 55 years old, when they conceive a child, so there's the high risk for the child to have autism, but not necessarily, I mean, not, I'm saying the high risk, not a definitive factor that they will have autistic child. So other factors include, or other risk factors include prematurity of less than 33 weeks of gestation, or if the child have problem lack of oxygen during birth, or the mother is exposed with toxins during pregnancy, and also family history. So study shows if you have a sibling who have diagnosed with autism, so there's a high risk that your other child will have autism as well. But not only autism, if the child has any other neurodevelopmental disorder like ADHD, learning disability, and so on, so there's a risk for your other child to have autism. Okay, so basically, this is something that I take from National Autism Research Center. Okay, the pathway, how to know whether my child have autism or don't have autism, when can I identify these symptoms and things like that. So normally it begins at the routine development screening, healthcare clinic at the age of 18 months, 24 months, 36 months, where you take your child for a routine checkup. So the doctor will see whether the child fulfill the developmental stage that they should reach by that time. If the doctor thinks that your child does not develop according to what it's supposed to, then they will refer to the audiologist and also to the ophthalmologist. So this is to make sure that the child don't have any hearing or visual impairment. Okay, so means that their hearing is okay and their vision is okay, yet they have the problem you think that the child have, or not normal, like not like other children. So if the hearing and the visual test are okay, means there's no problem at all, then proceed to the step 3, which is the MCHAT screening. So this MCHAT screening can be done by the primary care doctors, even at the clinic. Okay, so if the score at the MCHAT screening indicates the risk for autism, then only the doctor will refer to clinical psychologists. Some of the doctors will refer to pediatric first. Some will refer to child psychiatrist. So that's okay. That's fine. Okay, and then because like I say, one autistic child and another autistic child, the symptom is not the same. So some have very mild and subtle autism symptoms, and others is quite obvious or significant. So if it is quite obvious, so normally doctor will give the diagnosis there and then. But if it is like not really sure, the symptoms is quite subtle, or if you want to know the level of severity, normally they will refer to clinical psychologists to confirm the diagnosis of autism using CARS and GARS questionnaire. So I will explain a bit about this questionnaire later on. I saw a question, but I don't have time to read it, but I will go back to that later. Okay, so after we confirm the diagnosis that the child is actually have autism and at what level, whether it's mild, moderate, and so on, so we will refer to occupational therapists and also for to speech therapists. Occupational therapists for behavior intervention and speech therapists for the communication part. Remember, the autism characteristics divided into two, which is the communication and also the behavior problem. So therefore, that's why we refer to occupational therapists and also speech therapists. And if you have quite a good financial, so you can enroll them in an early intervention program, because early intervention program can be quite costly. So early intervention program it's quite comprehensive. They have occupational therapists there. They have speech therapists in the program. It's like you send the child to kindergarten, but a special one where you have in-house occupational therapists, because some have clinical psychologists and also occupational therapists in there. Okay? And also parents actually entitled to apply for OKU card for the child under learning difficulty, because under learning difficulty there's like ADHD, autism, specific learning disability. So you can apply it under autism, okay, and so you are eligible to get this OKU card. Okay, a lot of benefits from getting this OKU card actually, and you can go to the Social Welfare Department website and look into the benefit when it comes to education. Okay, some parents quite concerned, like, is it okay if I don't register for OKU? You know, what if other people know that my child is OKU? Okay, I don't need all that discount in utilities and things like that. Okay, but just yes, maybe parents don't need that kind of benefit in terms of discount in utilities, but what more important is what the child can gain from the education part when they have the OKU card. So the screening test that normally doctor will use or clinical psychologist will use. Okay, the first one, the first level of screening is modified checklist for autism in toddlers, which also known as MCHAT. Okay, so it's actually 23 item of questionnaire. Okay, parents will answer this question. Okay, this is for age 18 to 24 months of age. And this questionnaire has been translated in Malay and Chinese language. So it has been widely used in clinic, in KK, if they suspect that the child shows symptoms of autism. Okay, the next one is actually Gillian Autism Rating Scale. So this is more like the second layer of diagnosing a child with the autism. So the second tier. So it has 42 questionnaire. So this is for children aged 3 to 22 years of age. Because sometimes, because we are not exposed about all this autism, ADHD, we only know that our child is not really like other siblings, so but you don't know what is it. But it becomes apparent and the problem becomes sustained until they reach this adolescent period. Okay, so we can use this assessment to actually identify whether this child is actually have autism or not. We did diagnosis. Sometimes people at the age of 24, then only they come and say something is not right, even since my childhood, but I don't know what. And after we dig and ask few histories and things like that, so it happens that they actually have autism, undiagnosed. Okay. So the items are grouped into 3 subtests. So we are looking at the stereotype behavior, communication, and also social interaction. Okay, childhood autism rating scale. This is, we choose either one, like I choose cars or GARS, okay, to actually see whether someone has autism or not. So this is actually 15 rating scale used to identify children with autism. So basically, there are, if I'm not mistaken, 15 areas in this questionnaire, 15 questions. They ask about the severity of each component. So from there, you can see after completed the question, then you can see whether it actually fall under mild, moderate, or severe autism, the level of severity. Okay. There's also Asperger syndrome diagnostic scale. So this is basically a 50 question, yes or no item for 5 to 18 years old. So Asperger, because autism is a spectrum, so there's mild, moderate, severe, but there's also like high functioning autism. They don't have difficulty in speaking, so they can communicate. It's just that their communication is not the same like how people talk. They can talk, but usually they will talk about specific topic that they like, and it's difficult to interrupt when they talk or change the topic or the subject of the conversation. And they have difficulty to understand when people being sarcastic, you know, like the social communication part, the underlying meaning of the intonation of your voice, the facial expression, and things like that. So it's quite tricky to diagnose someone with autism, Asperger, because they can be very smart in certain areas, but after communicating with them, then you can see that it's not like the way you communicate with other people. All right. So when we want to diagnose someone with autism, there are a few things that we have to keep in mind. So these are the things that we refer as differential diagnosis. This is to make sure that you give a accurate diagnosis to children with autism. Okay, to make sure that you don't misplace this child in normal class and things like that. So the first and foremost, of course, the hearing impairment, visual impairment, selective mutism. Okay, that's why in the pathway that I shared with you just now, the second step is actually to rule out all these medical conditions, to rule out any hearing impairment and visual impairment. You know, like, because one of the symptoms of autism, when you call the child does not respond to you. So you don't know whether the failure to respond to you, is it because of the child cannot listen well or because of something else. Okay, so that's why it is important to rule out this medical condition first. Okay, so if you suspect that your child, sometimes it happens where we miss out this step, this rule out hearing and visual. So it's good if the doctor forgot to refer. It's good if the parents can, you know, remind them to refer them to the to rule out this hearing and also visual impairment. And selective mutism is a condition where a child refuses to talk. So it's not like the child cannot talk, but refuse to talk to other people. They usually will talk to very limited people, normally family members. It can be mother, okay? It can be mother and father, it can be brother. So it is important to make sure that if a parent comes to us and say, oh, my child don't rarely speak. So it's important to differentiate rarely speak because of the autism characteristic or rarely speak because the child has selective mutism. So with a selective mutism, in a clinic, they hardly respond to the doctor. But if they want to answer, they will whisper to the parents their answer. Okay, so that is the difference between having a speech delay or having a autism symptoms or selective mutism. Okay, so another thing that we need to bear in mind, okay, to make sure that we have an accurate diagnosis of autism is actually to rule out speech delay. Because symptom of autism communication is not the only characteristic or symptom to say someone has autism. It also, the other area that you need to look into is behavioral or repetitive and restrictive behavior. So if the child only has communication issue, so my child don't talk, but has no problem saying with other kids, you know, if you scold him or her, she understands. Even if I angry and show my anger face and the child understands, so most likely the child don't have autism but only have speech delay. So if the child don't have autism and only speech delay, so you only need to refer to speech therapist instead of send to EIT and things like that. Another diagnosis, I'm not going to discuss all, but another important differential diagnosis is ADHD, attention deficit hyperactivity disorder. Because some autistic kids, they are quite hyper, they are quite active. Some is quite slow, like play quietly by their own and things like that. So it's important to differentiate whether this hyperactivity is it part of autism or the hyperactivity is part of the ADHD symptom. Okay, you don't have to worry about this unless you are a doctor. So it can come together as well. You know, you can have autism with hyperactivity. We call this condition as comorbidity. So it can be autism alone, it can be autism with something else. Okay, all right. Okay, now for treatment and management. So when it comes to treatment and management of autism cases, so it involves a multidisciplinary. So you have pediatrician, you have psychiatrists, child psychiatrists. So especially when it involves medication. If like the child needs medication, normally if the behavior is too, you know, like some autism kids, they hypersensitive to things and sometimes they like to bang their head on the wall and things like that just to get a sense of things. So some of this behavior can be dangerous, some can need to be controlled by medication and things like that. Okay, and then we have clinical psychologists, educational psychologists, counselor. So clinical psychologist, occupational psychologist, speech therapist, occupational therapist, speech therapist. These are the teams under the EIP. Okay, like I said before, some EIP programs have clinical psychologists, some don't have one. So occupational therapist for the behavior part, speech therapist for the communication part. Okay. We also involve social welfare services. This is for the OKU card application and also educational officers for the school placement of the child. Alright, so these are list of support centers and also NGOs when it comes to autism. So we have National Autism Society, NASOM. Okay, they have a lot of programs from early education, mainstream program. They also do assessment and diagnosis, a transition program from kindergarten to get to the mainstream program. Then we have vocational for the adolescent, for the adult with autism, residential program, how to help them to live in the community. Okay, so we have NASOM. Okay, and we have Academy Remaja Islam Autisma. Okay, I also just got to know about this academy. So they offered sheltered workshop, okay, vocational skill where they teach you how to bake cake, pastry, make bread, catering, laundry. So it's quite good. And then self-care, okay, how to take care of yourself, how to social skills, to interact with others. Okay, and then we have Institute Masalah Pembelajaran dan Autism Malaysia, IMPIAN. So a lot of these centers actually offer EIP, Early Intervention Program. Okay, then they have functional academic program, pre-vocational training, engineers premier, of course, early intervention programs, school preparedness, community education, and we also know about Autism Project Cafe, started by a father who have a child, autistic child. Okay, so they open a cafe and then you can actually send your child so for training, and they see whether the child is actually suitable to work there or not. And then there's a Yayasan Gamuda where offer a 3 months employment transition program for those diagnosed with autism. Okay, so all right. So before I end this presentation, as you can see, like the transition, whether the child is actually suitable to go to normal school or not, I would suggest before the child goes to school or you decide whether you should put the child in a normal school or special school, it's good if you go for IQ assessment. So basically an IQ assessment will tell the level of cognitive function that the child has. So IQ assessment, some center they offer like at the age of 3, you can do an IQ test. But I personally think the best time to do an IQ test is actually at the age of 6 and above, before the child actually enter primary school, because cognitive function change over the years, depend on the exposure that you give to it. So at the age of 6, then you refer for an IQ test to look at the cognitive function. Then from there, we can suggest whether this child will be able to cope with the normal class or the child needs a special class for the education part. So, yep, I guess that's all for my presentation. Normally only one language, but I think they can speak bilingual, but they will excel in either one, whether it's in English or it's in Malay. I think because English pronunciation or the syllabus is easier to pronounce, so that's why they pick up this English faster. No, not necessarily. Like I said, the symptoms or characteristic of autism differ from one child to another. Some children, they can articulate words, they can speak. High functioning autism, of course, they can speak. It's just that the content or the structure of the speech is not the same as normal people. Some children, some autistic child, they can speak. So normally when we refer to speech therapists will do their own assessment. to see the level, at which level that the child is able to communicate. Okay, communicate doesn't mean that you can speak a sentence. Okay, so if the child cannot even point or identify objects, so the first objective is to make sure that the child is able to differentiate, like bottle, water, food, and things like that. So there's this they call the picture exchange system, where they use picture to communicate. So that's the stages, like you use picture, you use pointing, gesture, then only they will teach you how to articulate certain sounds. So you have to understand, not necessarily when you say, oh, refer to speech therapist, then after this must I can speak. No, but they can develop that speech. Mild autism, normally they don't really have like a communication issue that much. But for moderate, severe autism, sometimes they just squeak the sound, scream, and things like that. It's hard to tell like how old is the daughter, okay, and whether the daughter has siblings or not. And then like because sometimes if they feel lonely, they like to imagine things and speak to this imaginary friend, but not necessarily lonely. Sometimes sometimes child can just be playful. One of my niece also like to talk to herself. Okay, but if you like try to engage with the child, like who are you talking to, and the child like being playful and laugh and feel ashamed or like then most likely that the child don't have autism. So, like I said, it's important to see whether the child have other symptoms that I mentioned before to suggest that they have autism. So, like speaking alone, if that is the only symptoms, then most likely it's not autism. Postnatal jaundice is quite common in children, in baby. So that alone to cause autism is quite unlikely, but a combination of factors, okay, like I said that I share with you in the slide. Normally, there's no single factor that causes autism, but it's a multifactorial factor. So it's quite difficult to pinpoint which one of it. We can share, no problem, but it's just that this questionnaire supposed to be administered by a trained psychologist to have an accurate diagnosis. So unless you know how to score it, then only it is feasible for you to have one. If not, I would advise like MChat. MChat is quite simple. It's yes or no. You can find it if you Google it. If you Google MChat, you can find it. You can answer and you can score it. So MChat to me is okay, but for CAS and GARS, I think you need like certain level of training to be able to actually administer and understand what is actually the question is asking. Normally, we will only choose one diagnosis, like especially with GBD, because autism, they don't have any difficulties in other areas apart from the behavior and also communication. But when you talk about GBD, it's actually delay in all areas, like motor function, the physical development, the communication part. So if I were to give a diagnosis between GBD and autism, and the child fulfills the diagnosis of GBD, I will say I will only say that the child has GBD, because having a GBD, global developmental delay, explain all the difficulties or the challenges that the child faces. Because GDD is including the cognitive cognitive delay in terms of the cognitive development as well. If you want to make a changes, you change it bit by bit. Like for example, if your child only take porridge, okay, and you want to teach the child to take hard rice, so instead of you change it drastically from porridge to rice, maybe you change in terms of the level of consistency of the rice to make it more harder and harder slowly, so that the child can appreciate the slight changes instead of a drastic one. If you want to make them eat meat, so instead of you put like one chicken there, then maybe you can just a strip of chicken, like a small strip of chicken, or you can blend it so that it is not visible, so it only have a subtle taste. So that is one of the suggestions that I normally use to handle or to deal with this situation. And it's always like to have try and error, you know, to see something. If the child like noodles, for example, then maybe you can see whether bihun is also applicable, whether spaghetti is also applicable, you know. So it's always try and error to see what the child can handle and what they cannot handle. And if you want to add something, then you just make a small changes in terms of the food that you like. So after a while, then they will be able to take that. Well, early intervention is very important. So he is 5, okay. I hope you already send them to speech therapist, or if you have not, then you can start find a speech therapist. So in government sector, the appointment can be like once in 2 weeks once or 1 month once. It depends on the hospital. So you can go to private sector as well if you want to have more intensive communication, more intensive speech therapy. So yeah, so it's better to start as early as possible. Even now, even if the child is already 5, but it's never too late. You can start to send to speech therapist, and the most important thing is to practice what the speech therapist teach you during the session. The more practice that you do, the faster the child will pick up the language. Okay. If you can see that the new habit change your child behavior, so maybe what you can do is actually try to limit his not so healthy activity, so that you can change his interest into something else. It can develop as a habit if you keep on doing the same thing over and over again. I mean, even if you are not autistic, if you do the same thing repeatedly, it becomes our habit. Okay, so try to limit the access, and then try to engage with your child more, so that he can, you know, you can channel him to something else, doing something else. Child's behavior, it's hard to tell, because child's behavior, it can be because of the way we approach, our parenting skill, parenting style, okay, which influence of how the child will behave. So the child has GDD, if I'm not mistaken, global developmental delay, right? I'm not sure, like for other autism symptoms, how bad or how severe the condition, but it's best if you can have a look at the MCHAT and see whether it's actually, the score is actually suggestive of autism symptom, and if it does, then go to the clinic, get a proper referral, and we can do a proper diagnosis to see whether the child actually have autism or not. Yeah. Well, I'm not sure whether this is applicable to autistic children only, but in terms of activities. So it can be like puzzle, blocks. So these are activities that good for the cognitive function. Like, you know, the game where you pick, you choose, you memorize things. That my Tom also have that. So that kind of activities is good to actually enhance your cognitive function. Yeah.